I became a physician to really do everything I can to help a patient and spend the time needed to really help that patient get feeling better. So I decided not to take insurance, and it has been so much better. I've been become a much better doctor for my patients when I stopped using insurance because I was actually able to do everything I wanted to do and had all the freedom I wanted to treat my patients. And I'd had all the time I needed to be able to treat my patients very well also.
You're watching the Dr. Jake podcast.
What is a naturopath? So, the term naturopath can be synonymously used with naturopathic medical doctor or naturopathic physician. But there are a lot of people that aren't medically trained using this term of naturopath. So, a naturopath is someone that has received some type of training, many times online or something like that, in herbal medicine or in nutrition or diet and nutrition. But they haven't been in a medical institution and they don't know how to diagnose specific diseases. They haven't learned about anatomy or biology or all these other things, pathology, all these things to really make a pure diagnosis. A naturopathic physician, a naturopathic medical doctor has gone to 4 years undergrad, 4 years medical school, and then many times they have received residency. But a naturopath maybe has received a year, maybe a two of online training or something similar to that, and they can't make a diagnosis of a specific disease. So I just want to clarify the difference there. I'm going to be using naturopathic physician or naturopathic medical doctor specifically to put that differences between a physician that has actually been trained in a medical institution and those that haven't really been trained in a medical institution. So what is a naturopathic medical doctor, a naturopathic physician? Like I said, they have gone to pre-med training, 4 years of that, and then they have received 4 years of naturopathic medical school training, and then many times they receive residency training after that. So what makes them different than a conventional medical doctor is really their philosophical approach. So there is a philosophical approach of naturopathy, and there's a philosophical approach of allopathy. Naturopathy is identifying the disease, and if you remove the cause of the disease is cured. Allopathy identifies the disease too, but if they eliminate the symptoms of the disease is cured. And usually they decide to use a drug or surgery to do that. So the big difference there is a naturopathic medical doctor is going to dive in a little bit more deep because they don't want to be treating the symptoms. They don't want to put a band-aid on what's going on. They really want to know what is specifically causing the disease. So let's say you have an autoimmune condition like rheumatoid arthritis. A conventional traditional doctor, they're going to go after and treating the symptoms. Okay, the immune system is attacking the joints, so what we're going to do is give a drug of some sort to suppress that immune system response to keep the immune system from attacking the joints. But yes, the cause is your immune system's crazy, but why is your immune system going crazy? That's what a naturopathic medical doctor is going to do, is identify what's causing that immune system to do what it's doing right now. And I don't want to suppress that immune system because that's going to make that immune system not work now. So, but there's something making it not work appropriately. So that could be related to various things, and the naturopathic medical doctor is going to be the detective to identify what are the various causes of that specific condition, and they do that for all conditions out there. And they are going to use many different modalities to help a patient get better. They understand how to use diet and nutrition, a great deal of understanding on how to do this. A conventional medical doctor receives very little in nutrition. They don't really know how to prescribe nutrition appropriately, except if you go to one that has received postgraduate training and extensively in nutrition. They're not going to know anything about nutrition. If they give you any advice on nutrition, it's really doesn't mean a lot because they've received maybe 3 hours. And when I say 3 hours, that is literally 3 hours many of these medical institutions on just like the basics of what a nutrient is and what are some of the things that a nutrient does. That's about all the training they have received in that regard. But a naturopathic medical doctor or physician is going to specifically receive extensive training in diet and nutrition and what is the research on it to treat various conditions. They're also going to learn about how to use herbs, what's the science behind it, what are the specific dosages you need to do, and what's the literature on what it does for specific medical conditions. Also regarding a lot of different nutraceuticals, what's the research on that, what specific dosages that should be prescribed. They also learn how to use drugs in surgery, but the big focus, what they usually do is they use a drug in a way to not block a symptom. It's to treat a specific cause. So for example, let's say the cause of someone's autoimmune condition is Epstein-Barr virus. Sometimes they might prescribe an antiviral to treat that Epstein-Barr virus. Or let's say someone's cause of their disease is Lyme disease, or they're going to prescribe an antibiotic to treat that specific condition. Or let's say someone is really in bad shape and they need to be suppressed for a little time when we're working on identifying the cause of their disease. Because if we don't block those symptoms right now, the person is going to be in really bad shape. So we might prescribe something to block those symptoms short term while we're working on the causes, and then wean them off of the symptomatic medicine that a specific individual is taking. So, how is a naturopathic medical doctor or naturopathic physician different from like a functional medical doctor or a integrative physician? That's a good question. So, big difference is a naturopathic medical doctor has actually gone to a naturopathic medical school and received 4 years of training in this field of medicine. Functional doctor or physician, they could be a chiropractor or a medical doctor that just received a seminar on functional medicine. And now they're going to call themselves a functional medicine practitioner. So they might know how to use an herb or two or a little bit of diet to treat a specific condition. Now, over time, they might receive extensive training over the period of their lifespan, but they haven't had that formal training. What the type of training they usually have received is some type of online training, or they've gone to a seminar to train in this specific area. Now, some of these medical doctors or chiropractors or whatever, many of these doctors are called in functional medicine doctors. They could be really great and they received extensive training, but you don't know who you're going to. If you go to a functional doctor, they might have minimal training, but they're just calling themselves a functional doctor and they don't really know how to really identify what the true cause of your condition is. But if you go to a naturopathic medical doctor, a naturopathic physician, you can feel confident that they have received extensive training and they have taken specific boards and had to pass these in how to use herbs and nutrients and drugs and surgery and whatever, all these things that are regarded in this alternative model, and really have extensive understanding on that. A functional medicine doctor might be highly trained, they might not. You just don't really know in that regard. How is a naturopathic training similar to a conventional medical school, medical doctor training? So both have to do pre-med training, pre-med requisites. They have to take 4 years of undergraduate training. That's the same. Then they go to naturopathic medical doctor goes to a naturopathic medical school, and a conventional medical doctor goes to a medical school, or I'll call it allopathic medical school, because that's really their philosophical approach and really should be called the allopathic medical school. The first 2 years of training is very similar. It's your basic sciences that you're learning about. You're learning about your biochemistry or your physiology. You're learning about pharmacology and all these type of things that are basic understanding anatomy, basic understanding of what the body is and how it works. In their next 2 years, the training changes a little bit. The conventional medical doctor is then going to go focus more, learn a lot more about drugs and surgery, etc. They're going to do certain rotations with a lot of different fields of medicine to learn about what specific field of medicine they want to go to into for their medical school of residency. In a naturopathic medical school, we're going to learn about, at that point, at the third or fourth years, you're going to learn extensively about herbs, nutrients. You're also going to learn about drugs. You're going to learn about surgery. You're going to learn about all kinds of other therapeutics, maybe IV therapies, maybe other generative injection techniques. Those are extra trainings that you receive in this training. If you decide to do that at medical school, you don't have to learn some of these things. It just depends on where you go there. And you're going to do a little few rotations with some doctors in certain fields to know what type of doctor you want to be. So the big difference is they both learn extensively about the human body and how to diagnose disease, but their therapeutic approach and therapeutic model can be very different, like we talked about. The naturopathic physician is going to use their training and their treatments to treat the cause of a specific condition. The allopathic medical doctor, a regular medical doctor, is going to use drugs or surgery typically to treat a symptom of a specific medical condition that someone has. So those are the big differences in the training that you receive. All of them receive 8 years of medical school training, and then there's residency that goes on board after that. In the state of Utah, naturopathic medical doctors have to receive residency just like a medical doctor does. Depends on the state you go to with naturopathic medical doctors and naturopathic physicians if they have to receive a residency or not. So that's a good understanding of what's the difference between a naturopathic medical doctor and an allopathic regular medical doctor. Some people wonder if naturopathic physicians are covered by insurance. So in some states, they might be covered by insurance, like I know in Washington and Oregon and some areas of California and Connecticut, these type of areas, they do cover naturopathic physicians with their insurance. In most states, insurance has decided not to cover naturopathic physicians. That's not always true. There are many insurances that have decided to cover naturopathic physicians, but majority of naturopathic physicians have decided not to take insurance because it doesn't work with their model. So a typical naturopathic physician is going to spend about 45 minutes to an hour with the patient to really identify what is the cause of their condition. An insurance model is not made to spend that much time with the patient. It's made to spend about 5 to 15 minutes with the patient, and pay is based on that. So a naturopathic physician can't make a living very well taking insurance when they spend 45 minutes to an hour with the patient. It just doesn't work in that way. But there are some naturopathic physicians that do decide to take insurance in these certain states that I talked about, but they don't usually get paid what they're worth because insurance isn't based on really treating them that way, or they start treating like a allopathic physician and not really doing what they have been trained really to do. I did take insurance for a while in the first 2 years of my practice, and it really limited me of being the best physician I could be. I felt like I had to hurry through with my patients and not really spend the time needed. I also felt like the insurance company was dictating exactly how I could treat a patient and not treat a patient. And that's not what I became a physician to do. I became a physician to really do everything I can to help a patient and spend the time needed to really help that patient get feeling better. So I decided not to take insurance, and it has been so much better. I've become a much better doctor for my patients when I stopped using insurance, because I was actually able to do everything I wanted to do and had all the freedom I wanted to treat my patients. And I'd had all the time I needed to be able to treat my patients very well also. If you want to get treatment from a real naturopathic doctor, visit our website, integrativemedica.com, find our phone number, and set up an appointment with me. You can set up a in-person visit or a virtual visit, or with many of my other great doctors that we have at Integrative Medica. For more information on how to heal your body naturally, click on our next video. Thanks for watching.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, MEDICA.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform, and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.